Everybody. I think you guys ready and set? Do you have all? We're gonna have three speakers. Public Health Director Dan Petticord. I think Carl gave you guys all the names and titles, but I'll go over them again. Dr. Ord Cvieli is the pronouncer. Cvieli. Good luck with that. He is our Public Health Medical Director. Anna Roth is the Director of Contra Costa Health Services. She'll go last. County Administrator David Twa is here to take any other questions that he may need to take. First, we'll start out with Dan Petticord, who's going to go give a update on the situation in Contra Costa.
Thank you, Will. Good afternoon and welcome to today's press conference. My name is Dan Petticord. I'm the Public Health Director for Contra Costa County. And I'm joined today by Dr. Ori Cvieli, our Medical Director of Public Health and Deputy Health Officer, as well as Anna Roth, our Director of Contra Costa Health Services, and our County Administrator, David Twa. Last night, three additional Contra Costa residents tested positive for novel coronavirus, also known as COVID-19. Two of these were from the Grand Princess cruise ship that returned to the Bay Area from Mexico on February 21st. The same ship, as you might know, is currently harbored off the shores of the Pacific with a different group of passengers. The third person had contact with a known positive case from a neighboring county. All three are under home isolation and don't require hospitalization. Public Health is monitoring the health of these people and ensuring they follow CDC guidance. Public Health staff is conducting ongoing contact investigation for these cases. These cases demonstrate that our public health efforts to identify and monitor known exposures is working. This now brings the total to 4 county residents who have tested positive for COVID-19. The first person, who was reported earlier this week, is in critical condition at a local area hospital. I'll also refresh a previous update. Only one of the 4 travelers associated with the Diamond Princess cruise ship, these were passengers that were processed through Travis Air Force Base, remain in a Contra Costa hospital. That person who did test positive is doing very well and quite anxious to go home. We should anticipate that in the coming days and weeks, more cases will be identified. It is unclear how our first case of community-acquired COVID-19 was exposed to the virus. Unlike the other 3 cases, this person had no travel history or contact with another known case. This is why we are recommending the community take the steps we are about to discuss to limit risks to COVID-19, particularly people who are most vulnerable to the illness. I'll also update that we are now testing for COVID-19 at our county public health lab. We have received more than 300 test kits from the CDC and have capacity to meet current demand. We have also offered assistance to the state in testing those passengers that are on board the Diamond Princess cruise ship that I commented on earlier. I would now like to hand it over to Dr. Ori Cvieli.
Thanks, Dan. My name is Ori Cvieli. I'm the Public Health Medical Director and one of the Deputy Health Officers for Contra Costa County. Contra Costa Health Services is now releasing new recommendations to try to help to protect the most vulnerable patients in our community from novel coronavirus. These guidelines are for people who are at highest risk of becoming seriously ill. Those are people over 50 and people of any age who have chronic medical conditions such as diabetes, cardiovascular disease, cancer, lung disease, and immunosuppression. People at higher risk should avoid mass gatherings such as concerts, sporting events, or parades. This advice does not apply for people going to work in an office building or going to the grocery store or the mall, places where people can usually stay more than an arm's length away from one another. Facilities caring for seniors or medically vulnerable patients or people should cancel large gatherings such as bingo nights, movie gatherings, etc., and should be very vigilant about cleaning and screening visitors for illness. We are not recommending school closure at this time. Public Health will update school districts on a conference call on Monday. Want to remind people of some of the best ways to help protect themselves. Wash your hands frequently with soap and water or use a hand sanitizer. Avoid touching your face. Clean frequently touched surfaces or doorknobs with regular household cleaners. Those work fine. If you are sick, stay home from work or from school. The other thing to remember is when you're sick, contain your sneezes in tissue paper or sneeze or cough into your elbow. And remember, masks are for sick people. There's no evidence that wearing a mask reduces the risk for a healthy person from becoming infected. I'd now like to pass it off to our health director, Dr. Anna Roth.
I'm not a doctor today, I'm a health director. Thank you for being here today. And as you've heard, there are early signs that coronavirus may be circulating in Contra Costa County, but there is still a lot that we can do. I want to focus today on a few things. The first thing is I want to ask people to focus on facts, not fear. There's information and guidance out there, and there's a lot, and it's changing quickly. We will be keeping you updated. We recognize that we're asking people to take steps that are to some disruptive, and it may be disruptive in their lives. We're only asking the public to do steps that we believe will have a positive effect on reducing community risk from the coronavirus. We know we're all concerned about coronavirus, and we need to do things to keep our families safe. We're asking for you to think and from a place of reason and not rumor. Credible information is very important right now. We're in this era of social media, it's really important that we use trusted sources like cchealth.org. cchealth.org also has links to the CDC and California Department of Health, or CDPH. Also remember that the vast majority of people that you might encounter with COVID-19 will not become seriously ill, and most will fully recover. We do expect more cases in our community, so let's not fear get the better of us, and let's not stigmatize. This is our community, and this is a time for us to look out for each other, not try to figure out who we need to stay away from. So I want to summarize that with, we really want you to focus on solidarity and not stigma. We've seen some unfortunate examples of that in other parts of the world. We do not want to see that in Contra Costa County. Now is the time for preparation, not panic. We're working with all cities, schools. We have all branches of our county government working together. We're monitoring and communicating daily with the CDPH and CDC. And we and all of our partners will continue to update any advice or guidance for any particular groups in our population, and we'll keep you posted. Thank you for coming today. And if you have any questions or you want to talk with any of us, we're happy to take your questions now.
All right, so Dr. Svieli, so now if you guys have questions, I'm going to have Dr. T field those for me.
There'll be a call on Monday to talk about schools. One of the things we recommend is for people to stay away from large gatherings. You got several high schools right now playing high school basketball games. You've got volleyball. What recommendations do you have for those schools who will be playing in the playoffs this weekend?
At this point, we are not recommending canceling the sporting events for those groups because the people participating in those activities and kids specifically are not in the highest risk population. However, if there's a particular parent, relative who does have one of those chronic medical conditions or is elderly, we recommend that they think twice about attending because they would be putting themselves at risk if they're going to a large gathering. So, so we're not recommending canceling those sort of school events, but each individual should really consider their situation and take appropriate precautions.
Are there any new guidelines or recommendations for restaurants in the county, or say like drive-through coffee kiosks, that sort of thing, which would be handling people's credit or debit cards, et cetera, and could be passing germs?
Not at this time. We're not recommending any sort of closures or anything like that, but we do ask that both employees of restaurants and customers practice good hand hygiene. So remember, wash your hands a lot, use hand sanitizer, and that's probably the most important step to take to reduce transmission of COVID-19.
Obviously, you made this decision based on sort of the evolving nature of events and what we're all learning day to day. I think we all are sympathetic to that. What are you looking at that could change your decision making ahead? Like, what else are you looking at that you say at this time? What could happen that would cause you to go back and look at this beyond the parameters of the vulnerable population that you're talking?
Yeah, that's a great question. Some of the parameters that we're looking at to make all of our decisions is how much COVID-19 is there in our community? How much of that is from travel-related sources or certain predictable contacts like the cruise ships versus community transmission? So far in our county, we've only had one case of community transmission that we know of. Our communicable disease professionals are doing contact tracing, looking at where that person has been, where they could have got it, the other people in their lives. When appropriate, that we're doing testing. So we're ramping up our testing. We're doing more and more all the time. We expect to see more cases because of that. And we're looking to see where they're coming from, and are there clusters that we can identify, and are our current measures failing us? And if that were to happen, we would up our measures.
Just a quick follow-up. You're talking about, that goes back to the known cases, that you're identifying
Yeah.
known contact cases. Can you give us an idea of how many more of those there might be that you're trying to run down, and what the scale of that window might look like?
We really don't know. I wish I could give you an answer, but we really don't know how many cases are out there in the community. We are, our health officers are in contact with all of the local health departments. So, Contra Costa Regional, John Muir, Sutter, Kaiser, and we're in contact with them all the time. We have many, many calls a day where they call us with patients who may have symptoms. We look at the CDC criteria to see if they're appropriate for testing. We test them, and then we give the results back to the systems. So I wish I could give you an answer how many more people are out there. We just don't know. But the trend of the disease right now in the United States is that many communities are seeing more and more cases and are testing more and more. So we expect the numbers to go up in the next few days and weeks.
The governor yesterday said that anybody that needs to get a test, like 20 million Californians, can be tested free. What capacity do you have to test here in Contra Costa County?
Right now, we would love to offer a test to anyone who wants it. Right now, we don't have that capacity, and that's limited by some of the testing supplies that we have gotten. So right now, today, I can tell you we have the capacity to test about 40 people a day in Contra Costa County. If we needed to test more people than that, we have the option of sending those tests over to the state lab in Richmond or to the CDC lab in Atlanta. So we can do more tests than that if necessary. We also expect that some of the commercial labs like Quest and LabCorp will get online next week and be available to increase testing at that time.
Are you testing that many people a day, 40 people a day?
I haven't looked at today's numbers. We weren't quite up to that yesterday.
So you were saying that at this point you're not recommending the cancellation of like massive events. Are there like any precautions like regarding to events? I understand that some churches have started like telling people not to, do certain practices. So what would be your recommendations for like going in public, like, go to a coffee shop or something like that?
Yeah, so at this point, I think it really depends on the individual's own level of risk. If you are elderly, you should be more cautious. If you have chronic medical conditions, you should be more cautious. And that's sort of where we're at now. We're not recommending wholesale cancellation, we have talked to employers. We've given some guidance about allowing employees more liberal sick leave policies, because we really want people who are sick not to come to work. That's one of the most important things right now. We're also encouraging more telecommuting and work from home. And if you're not sure, if you think I might be getting sick, or maybe have the sniffles, maybe in the past I might have toughed it out and gone to work, this is not the time to do that. This is the time to stay home and make sure to protect your community. Other questions?
Following up on what you talked about the schools, we're gonna have a call on Monday to talk about what brings up that call on Monday. What are you gonna talk about?
Oh, we just have, sort of like today, giving the schools the latest in situational awareness, how many cases we have. We have not had a case in a school in Contra Costa that we know of. And also letting them know what our thinking is around schools. Schools are a complex environment. We know that children don't have severe, for the most part, don't have severe disease with COVID-19. And so they're not the highest risk population. And canceling school is a big deal. A lot of working parents depend on them. A lot of kids depend on them on schools for lunch and activities. And healthcare workers depend on sending their kids to school so they can come and take care of the rest of us who are sick. So it's a complex decision, and we'll just tell them the latest thinking of where we're at and what our community looks like, and offer a chance to ask questions.
You getting a lot of calls about this?
We do. We get calls from everyone. Yeah.
Is there any way to know how many tests were done in this county?
We're not releasing exact numbers of tests that were done, and there's a little bit of complexity to those numbers, because some of them were done in this county, but were done for patients that were evacuated from one of the cruise ships. And so there's a lot of testing there's a lot of coordination between the state and local public health departments, and local public health departments as far as, where do we test based on where the patient lives or works, or where their exposure was. So we do a lot of that kind of coordination. So I think any number I would give you would have a lot of inaccuracies built in. Yeah, that's the best I can say right now.
You see an end to this anytime soon?
I don't think it will be anytime soon, as best I can tell. I wish I could say that, and the truth is nobody really knows, because this is a brand new virus. But right now we're sort of in a phase of increasing cases and increasing public health response. We've had two past outbreaks, the SARS epidemic and the MERS epidemics, that we were worried would really spread around the world, and they actually sort of died out in Asia. But this pandemic has already killed and affected more people than those past two epidemics. So we're concerned. That's why we're here talking to you. That's why we're ramping up our testing. And that's why we're giving guidance to people at high risk. So I think we're looking at, at least a time frame of months, if not longer.